Filtration pressure. Glomerular filtration follows the same principles that govern filtration in other blood capillaries, but there are significant differences in the magnitude of the forces involved. The blood hydrostatic pressure, or BHP, is much higher here in other capillaries. This results from the fact that the afferent arteriole is substantially larger than the efferent arteriole, giving the glomerulus a large inlet and a small outlet. The hydrostatic pressure in the capsular space is about 18 millimeters of mercury, compared with a slightly negative interstitial pressure that exists elsewhere. This results from the high rate of filtration and continual accumulation of fluid in the capsule. The colloid osmotic pressure, or COP, of the blood is about the same here as anywhere else, and is 32 millimeters of mercury. The glomerular filtrate is almost protein-free and has no significant colloid osmotic pressure. However, this can change markedly in kidney diseases that allow protein to filter into the capsular space. On balance, then, we have a high outward pressure of 60 millimeters of mercury, opposed by two inward pressures of 18 and 32 millimeters of mercury. This gives us a net filtration pressure, or NFP, of 10 millimeters of mercury in the outward direction. In most blood capillaries, the BHP drops low enough at the venous end that osmosis overrides filtration and the capillaries reabsorb fluid. Although BHP also drops along the course of the glomerular capillaries, it remains high enough that these capillaries are engaged solely in filtration. They absorb little or no fluid. The high blood pressure in the glomeruli makes the kidneys especially vulnerable to hypertension or high blood pressure. This can have devastating effects on renal function. Hypertension ruptures glomerular capillaries and leads to scarring of the kidneys, or a condition called nephrosclerosis. It promotes atherosclerosis of the renal blood vessels, just as it does anywhere else in the body, and thus diminishes renal blood supply. Over time, hypertension often leads to renal failure, and renal failure leads to worsening hypertension in an insidious positive feedback loop. Glomerular filtration rate. The glomerular filtration rate, or GFR, is the amount of filtrate formed per minute by the two kidneys combined. For every 1 millimeter of mercury of net filtration pressure, the kidneys of a young adult male produce about 12.5 milliliters of filtrate per minute. This value, called the filtration coefficient, depends on the permeability and surface area of the filtration barrier. The filtration coefficient is about 10% lower in women than in men. For males, the glomerular filtration rate equals net filtration rate times the filtration coefficient, or 10 millimeters of mercury times 12.5 millimeters of mercury, equaling 125 milliliters per minute. In young adult females, the glomerular filtration rate is about 105 milliliters per minute. These rates are equivalent to 180 liters per day in males and 150 liters per day in females. These are impressive numbers, considering that it is about 60 times the amount of blood in the body and 50 to 60 times the amount of filtrate produced by all other capillaries combined. Only a small portion of this is eliminated as urine. An average adult resorbs about 99% of the filtrate and excretes 1 to 2 liters of urine per day.